Hello, my name is Dr. Mario Romero. I have been a restorative dentist for 24 years, and we are here to share with you some tips and tricks on how to use or be efficient on using a rubber dam isolation. When it comes to material selection for our advanced rubber dam isolation technique, all we need to do is add the B4 clamp, the 212 clamp, and a straight scissor for our split rubber dam technique. When it comes to perforating our rubber dam using the Ainsworth rubber dam punch, I recommend selecting only 3 size of punch holes. The largest for the retentive clamp, the second to the largest for every molar, and the second to the smallest for every premolar or anterior tooth. Okay, so first we're gonna place the clamp around our abutment tooth on the right side of the patient. We're gonna use as an abutment tooth our first premolar. This is gonna be followed by wrapping the rubber dam around the distal aspect of the bow of the clamp, and then securing the clamp underneath both jaws, buccal and lingual. Then we're gonna go ahead and apply the second clamp on the contralateral side, first bicuspid as well. And we're going to now insert or wrap the rubber dam around the distal aspect of the bow of the clamp on this side as well. This is going to be followed by us stretching the rubber dam and making it and securing the rubber dam with our rubber dam frame. Now we're going to go ahead and make sure that we're going to secure or attach the lingual aspect of the split rubber dam to the patient's palate using blockout resin. When you're light curing this blockout resin, make sure that you're moving the light mesial and distal or left and right so that you don't overheat the tissue around this flowable composite. Once the lingual aspect of the split rubber dam has been secured to the palate of the patient, then we're going to go to the facial aspect and we're going to fold the rubber dam underneath the lip. So our goal now is to restore or isolate the cervical portion of this lateral incisor. As you can all see, the rubber dam is covering part of the cervical portion, and if I had, let's say, a class 5 lesion or a cervical caries or root caries on this tooth, I will not be able to access it with the rubber dam in place. So the first thing that I need to do is always secure your rubber dam using a retentive clamp like the one I chose here, a W2, which is a clamp for premolars, and you've seen that I've located the clamp around the second premolar. Then I've made perforations all around across the arch, all the way to the opposite side. So you can see here my first premolar on the opposite side is isolated as well, and I have secured now my rubber dam using a wedget. Once my rubber dam is secure and correctly inverted, just like you're seeing right now, I am ready to use a retraction clamp. This is the 212 clamp that the goal of this clamp is to push this rubber dam and the tissue apically so that I can have access, not only visual access, but clinical access to that area that I want to restore. So what I normally do is I'm going to push the rubber dam a little more apical. I'm going to set the 212 clamp, and once I know that it's seated, I'm going to grab it from the bows and I'm going to push it apically, and I'm going to let go of the jaws so that it can now sit positively around the cervical portion of the tooth. And you can see that I have been able to now isolate that cervical area. You can see a little bit of the root surface, and you can see the CEJ of the tooth as well. One more thing that you want to make sure that you always do is secure these retraction clamps, and I like to secure them with a blockout resin. And the reason why you do this is so that the clamp doesn't move during your operative procedures. It doesn't go anywhere, it doesn't fly out of the patient's mouth, and you have it nicely secured. So this is what I'm doing here. I'm just applying a little bit of the blockout resin, making sure that I wrap it around the clamp so that I can secure this clamp again around the clamp. Hit it with the light. Sometimes the flowable composite can be a little bit runny, just like you're seeing right now. Make sure that you add a little more to that pre-polymerized composite, because again, what you want to do is secure the clamp. Just in case you touch it with your fingers, you don't want it to move, because you want to make sure that you have access to the area that you want to restore. As you can see now, I have been able to now retract the rubber dam, push the tissue away. I'm actually now touching the cervical aspect of the tooth. There's a little bit of the root surface here exposed. If you look at the mesial side, this is where the caries lesion is actually located on this tooth. And I'll show you, we'll get a different shot of this, but there's a little bit of a caries lesion on the mesial aspect of the root of this lateral incisor that I'm actually, right now at this moment, I have direct access, not only with my instruments, but most importantly with my eyes. I can see where the lesion is located. Now I can go ahead and restore it with good isolation so that I can have a predictable final restoration and outcome. We're going to retract the rubber dam here, and now we're going to push down with this B4 to the final position. There's number one, and now I'm going to place a second B4 so that I can have both access on the cervical aspect of both central incisors. Again, we push the rubber dam. We push it down with the bow. We make sure that we are retracting. And now you can see both central incisors. If you want to push more apical, you can always grab the clamp, since it's not retentive, and you can push it more apical and seat it in a way that it gives you access to the areas that you want to work around. Always make sure that after you place the clamps, we're going to go ahead and secure them with a little bit of blockout resin. This way the clamp is not going to move, since it's not since it's only a retraction clamp. You want to have this extra stability adding this composite. As you've been able to see, both of these techniques are very helpful for everyday dentistry. So I hope you use these tips and apply them immediately in your practice.